Back with Bobby and JG Radio. We have two special guests today. Mr. Adam Ratner. He's a radiologist, professor of radiology and medical humanity at UTESCA, and also the chairman of the Patient Institute, along with Varda Ratner, which is the president and CEO of the Patient Institute. And I want to talk about some of this program that you guys offer for potential patients and their families, how to talk to your doctor. Tell me more about the education that you're given in that regard.
Well, many patients don't realize that they can question their doctor, and we've decided, we actually recently started to focus mainly on senior patients and their caregivers. And what we found in doing educational programs for seniors is they're afraid to question their doctors. They're afraid, they feel like, some of them have actually said to us, I can't question the doctor's God. Right. Doctor's like God, and we're like, no, they're not.
How about screaming? Does screaming work?
No, it's not effective, at least. Yeah, my wife works at UTESCA, and she questions my doctors all the time to the point where it annoys them. I can tell that it never happens to them.
It's true. They're not used to it, but they need to be used to it. And and it's far more challenging now, too, because doctors have far less time to spend with their patients because of all the changes and the complexities in the healthcare system. Sure. Doctors... you're lucky if you get 15 minutes. Many times people get like 5 minutes with their doctor. So we encourage people to prepare their questions ahead of time, write them down. We also encourage them to write down the answers, because research shows 80% of patients forget what the doctor told them by the time they leave the doctor's office.
That's kind of important, right? It's a little bit more important than like what the used car salesman said when you left.
Well, and out of the 20% that think they remember the answer, 15 out of the 20 get it wrong.
Wow. Yeah, so that's a huge
so it's very important to write down the answers so you know what you're supposed to be doing when you get out of that doctor's office.
That's great advice. Yeah. So let's switch gears here and talk about your geriatric counsel.
Yes, when we decided to focus on seniors, we asked one of our board members, Dr. Robert Parker, who is a geriatrician at the UT Health Science Center.
About to have him on,
he's going to be on with us. And so Bob is agreed to chair our geriatrics council for us, and he's put together this amazing group of people who are represented, who work in senior with needs of seniors, and anything from not just the medical side, but the socioeconomic side. We have an architect who specializes in building senior living facilities. We have a financial planner. We have an elder lawyer, and we have someone who runs, Barbara Lambert, who's going to be on also, who's on our board of directors and on our senior council. She's a wonderful woman, and she runs a business that helps families find senior living facilities that are appropriate for their family member who needs it.
Can you tell us what's the plan for the council?
The council's plan is right now they're developing a speakers bureau to give talks on all these different subjects that they're experts in, and getting other experts in to help seniors and their families learn more and more about what's important and what's going to affect their navigation of the healthcare system.
I'm not a professional, but if you need a speaker, let me know.
You will let me know. We'll talk after. You can tell me what your expertise. You look a little young to be an expert on seniors, but okay.
Well, let me warn you. He knows about 15 English words, so it's not going to be long.
But he's funny though, and that'll bring him in. Yeah, that'll bring him in.
That's true. We'll say comedy tonight.
So we got an architect, an elder law attorney, home health person, and also elder fraud. Right?
Yes, we have a banker from Frost Bank on our council who's an expert in elder fraud. We have someone who owns a company on it's called AA Services, and they coordinate home health care services, home care services, and in fact we use them for my mother-in-law, his mom. So
that's awesome.
Who else do we have on there? We have someone from the Alzheimer's Association, the executive director of the Alzheimer's Association. So it's an amazing team. So they're putting together a speakers bureau. We're also developing more materials. We're developing a booklet on that we're going to call the Hospital. That's
a
good.
Great name.
Adam came up with that.
Adam,
I was going to take credit for it, but
and it's really on how to help your senior family member survive the hospital stay.
I love it. And so, Adam, let's talk a little bit about the conditions and diseases of healthcare, and what are you researching on it?
Well, that's one of my fun projects, and one of the things the Patient Institute is, it's a bit of a think tank, and turns out that physicians and other scientists have created lists of diseases of human beings. And it's a very comprehensive list, and it's long, and there are a million things in it. But one of the things that occurred to me a couple years ago is that the healthcare system, which is basically a complex organism, also has diseases. And those of us who are physicians and patients and other stakeholders in the system have to contend with all the diseases and problems of the healthcare system.
Right.
Bottom line is that no one has identified, or no one calls each of these problems by a specific name. And it turns out in medicine, in order for us to cure a disease, we first have to go through a series of steps. The first step is to agree on what we're going to call the disease. Once we've decided what we're going to call the disease, then we have to figure out how it works and the epidemiology, in other words, where you find the disease. And then you can start to work on remediating it, making it better.
Vaccinating.
And then ultimately curing it, and even better, preventing it.
Right.
So the idea behind this project of the Patient Institute, which we call Conditions and Diseases of Healthcare Systems, or CDHS, is to start naming all the problems of the healthcare system so we can start measuring those problems and then starting to actually fix them instead of just complaining about it. What we see physicians and patients doing all the time is complaining about bureaucracy, complaining about red tape, complaining about how this doesn't work or that doesn't work, but it doesn't get fixed because we don't identify the diseases specifically like we do diseases of humans.
Right.
Well, it's weird because I think JJ has Zika, but it only affected his brain, not his head. It shrunk his brain a little.
So that's why his head still looks big.
Yeah. So it's kind of hard to... But it's
thank you for bringing it on to clarity for us, Bobby. That's awesome. So
one of the things I would like to emphasize, though, at some point, and I'm just going to take the time now, every program that we do at the Patient Institute is free. So whether it's something that the Geriatrics Council does, whether it's the booklets or other programs that we have, we do them for free. And that's one of the missions of the Patient Institute to do.
we're going to take a quick break. We'll be right back with Bobby JJ Radio.